Hello, Miami. Welcome to Let's Chat with Disco George. Today, I have a question for you. Do you by chance have pains in your neck, back, or maybe vertigo? Well, I have MNRS here today, and they're going to explain some of the technologies they have and treatments. And I'm telling you, I could personally attest that they are the best in Miami. Guys, thank you for coming.
Hi, George. Good morning.
George. Thank you for having us.
How's it going today?
Very good.
You
Very
guys
good.
excited to be here?
We are.
This is
We
great.
are.
Great way to get a Friday going.
There we go.
Happy Friday, by the way.
Yeah, el cuerpo lo sabe. So let me ask you, let's get into the thick of things. First of all, I want to thank both of you for the fantastic location that you have at South Miami. I haven't been to Kendall yet. I'm waiting for an invitation.
And it's open to you anytime.
All right.
It's your house.
Thank you. But I could tell you from the moment that I walked into your location, I was greeted by your front door staff. Fantastic. The evaluation, fantastic. And I could honestly tell you that all of my years that I've been to physical therapy, your location is the best I've dealt with. Before,
Thank you for that.
I could honestly tell you, a doctor would tell me, "Oh, you're gonna go to therapy," and I was like, "Ay, Dios mío,"
The office is very central. We're
Exactly.
close to you guys here at the studio, and we've been there for 20 years. We opened MNRS in 2003. So it's been over 20 years. We're very centrally located in South Miami, and then we also have a Kendall location on 114th and Kendall Drive, close to the Turnpike. So we get patients from all over Miami, as far as Homestead, Hialeah, Aventura. They'll travel down to come see us, and we pride ourselves in doing the best possible physical therapy. We take our time, thorough evaluations, complete treatments, a lot of different treatment strategies, a lot of technology. We have new technology. We have laser therapy, and we do great work. We really do.
Let me ask you, how did this all come about?
So I've always had a passion for treating the spine, an interest in the spine. So we got together in 2003 with a neurologist, and we decided to open up a company where we specialize in therapy for the spine, for dizziness, for vertigo, for balance. And throughout the years, I've had the luxury of always having neurologists to consult with, which I think, it's really been beneficial as in my career, because I would always go to him with questions on MRIs or diagnostic testing. Look, what is this? Is it okay to do this? And through the years, I really got to learn a lot about diagnostic testing and the importance of it, taking it into consideration with treatment. So that was a plus.
Let's start with back, because that's the one that that's how I found out about you guys. I have my back problem. I know that you guys have a gym. So talk a little bit about the gym and the treatments that you guys that at your location.
Right. So we create like this flow, and when you walk in, after I evaluate you, the gym is going to be always that second day. We're going to hang out at the gym. We're going to do some exercises. There's a lot of variety of equipment. If there's a person in a lot of pain, then I have alternatives like the table area. They're completely separate areas. The gym is more like, it has that upbeat music. We have equipment. We have other staff. There's a lot of energy. There's a lot of joy, and we're motivating, very motivating. But we're very attentive. So one of the things that I hear is, "Oh, you're not going to leave me alone, right?" And I'm like, "No, of course not. We're going to guide you all the way." So people feel like that attention is like, we take pride in that, giving you that attention and guiding you. Hey, this is not the way you do it. Do it a little bit better. Let's do it this way. Let's do it that way. And people learn. So it's like a learning environment, but it's also a gym.
Exactly.
And then we have the table, environment, which is like quiet, zen, almost like a spa feeling. And it's a completely separate area. And that makes us very unique, because a lot of times it's all in one in one room. And we've separated our services into special areas.
Okay.
And it feels good. It's a good feeling when you go in there.
Speaking of feeling good, one of my favorite things that you have at your location is that water, I guess it's like a water bed therapy.
Yeah. Yeah. We have our water bed. It's like a jacuzzi, but you don't have to like
Get wet?
yeah, there's no plunging. And we have that, and we have a lot of our manual therapies, you know, our tools, my favorite tools, my hands. And we get in there and we get into the nitty gritty. We get into those knots. We get into finding what the pains that maybe the MRI showed this, but we find that. And people love that because not everything is always going to come up in imaging, believe it or not. And I find stuff all the time that's outside the box that helped that person get even better.
Yeah.
You know?
Yeah, you have like magic that you know exactly where to go to and find where the pain is. And I'm like,
it's on my radar.
That's exactly where my pain is.
Yeah, it's my radar. I have a GPS.
So we do a lot of hands-on, and we also, have specific exercises that we teach the patient so that when they finish with us, they can continue doing specific, custom tailored stretches, exercises that will help them with stabilization, with posture, injury prevention. So the benefit of coming to us doesn't stop, with the therapy, but it's a recurring thing that they can continue to use the skills that we taught them indefinitely, because a lot of maintaining a healthy spine is a lifelong commitment to exercise, good posture, stretch, good body mechanics. So, and when they come in, they learn these exercises, and right away they can start using, good body mechanics with their activities of daily living and see the benefit right away.
So being on the sofa with a remote is not a good therapy?
So as we know, right, life can get very sedentary, and, being in poor postures can cause damage to the spine. So it's important to change postures frequently and just try to get back into the habit of exercising. It really just comes down to practicing it, and eventually it'll become a habit and you'll look forward to doing it.
Let me ask you, all right, let me ask Carolyn, talk a little bit about the laser that you brought for us today.
So I love the laser. It's a technology that came out in the early 2000s, or FDA approved this particular laser. It's a level 4 laser. It's warm. And even though it's warm, it's actually a deep anti-inflammatory effect. So let's say I have somebody, and as much as I want to say I have that GPS like we were talking about with my hands, it's something just deeper. It's more delicate. It's just even a person that's very sensitive, and they just need something that is effective, anti-inflammatory, and it doesn't even require that I touch the person. Okay. And I could go I hover right over the skin. And I find after I do my navigation techniques and I find problem areas, we go ahead and say, we're going to do laser there. And all it takes is 6-7 minute lasers, and we have big anti-inflammatory effects, and it increases oxygen production and healing at the cell level.
What's great, George, about the laser therapy, it's completely safe. What it is we use light therapy, right? It penetrates through the person's skin into the deep cells. It helps regenerate the cells, so it helps speed up healing. The recovery process. Patients feel better right away, so they start moving more, they start taking more action in their life. And as we know, it's all about just taking movement, taking action, and living a more active lifestyle.
Let me ask you, is there anybody that cannot use the laser?
So there is some people that can't use the laser therapy, different conditions that they can't use the laser therapy.
It's like a pacemaker, for example.
So in other words, if you have metal in your body, you can't use it?
Not in the area where the hardware is, but in other areas it can be used.
Okay.
Exactly.
So there's very few contraindications. For the most part, it can be used on just about anybody.
Yeah, I've used it on my own child after she had, she's in dance. She had a little muscle injury. And, you know, I didn't need a doctor's prescription for it. In other words.
And again, it's completely safe treatment. So it's very effective. It's the latest technology now. It's being used in a lot of sports teams are using it, a lot of athletic departments.
And what areas can you use it in?
You can use it in the neck, low back, knee, shoulder.
I've used it on the TMJ, right on here, on the facial areas.
Okay, what's a TMJ?
Oh, temporal mandibular joint. It's, you know, clicking the jaw.
The
jaw. And so that's how much we can, like, our professional work can go from jaw to toe to the ear. We can talk about the ear, which is all of vestibular.
Let's hear about the ear.
The ear. So the ear.
So when she's talking about the ear, what she's talking about is the fancy word for it is vestibular rehabilitation, which your vestibular system is in your ear, and it's the system that tells your brain where you are in space.
Okay.
And it works automatically. If it's working properly, it should work automatically. So if I bend, if I look up, if I lie down, it'll tell your brain where your head is. And along with vision, right, and sensory, these are the sensory systems that help with balance. And as we know, over the age of 65, 1 in 3 adults does not do well with balance, and falls are very common. So patients will come to us because with complaints of dizziness, vertigo, balance problems, and both me and Carolyn are certified in vestibular rehabilitation and concussion.
Right.
And being certified, we have these, additional skills as physical therapists to treat these patients. And for example, somebody that has vertigo, the symptom is a false, you feel like the room is spinning.
Yeah, like so if you get turned in a chair, like if right now we had you in a chair and I just started turning you and I stopped you all of a sudden, that feeling that you're still spinning? That's what vertigo feels like.
So they'll lie down, turn in bed, and get this false feeling that the room is spinning. And what's interesting is these patients will come in, we'll evaluate them, and this can be fixed in 1 or 2 treatments. So they don't have to live with this.
Like it's over.
It's really an easy way to fix it. And then once we correct the vertigo, some of them will have a lingering dizziness. And then we'll give the patient exercises that will address the dizziness, and ultimately that'll subside as well. And if there's anything going on with the balance, we'll show them balance exercises to prevent, future injuries.
And the cool thing with the vertigo treatment is, remember that table part of the clinic that I talked about? You don't even need to step foot into the gym for those type of conditions necessarily. It's literally positional treatment. So it could be abuelita, that's 80, 90. All we've got to do is say, we're going to lie you down in this position for a minute, then in this one, then in this one. It's going to be okay. Don't worry.
Very safe, completely safe.
In 6-7 minutes, we go through it. We give them a little 5-minute break. We repeat it. And many times...
in one visit, gone.
Abuelita is not dizzy.
It's like magic.
Yeah.
So, and it could be, it's a variety of ages that we see these type of conditions. And a lot of times it's unfortunate. People don't know what's happening. They think they're having a stroke, or they think there's something, and they end up in the ER getting worked up. And then they get a prescription. You have vertigo.
Yeah.
And it's like,
what's even worse, they get a $70,000 hospital bill.
Exactly.
And they leave the hospital and nothing's better, nothing's been fixed. And they still have to go find a therapist to treat them for the vertigo.
It's funny. I didn't know you guys treated that. And I actually know somebody that is going through that right now.
Yeah.
And I'm going to show him this video so he can go see you guys, because he's been dealing with that.
Time.
Yeah. The most common diagnosis for vertigo is called BPPV.
Which is,
what's BPPV?
The benign paroxysmal positional vertigo. So it has a fancy name.
It's all inner ear.
Yeah.
It's all in there.
All right.
It's a treatment of the inner ear. And it seems complicated to even talk about now, but it's actually, for us, it's simple when we can get the job done quick. And patients are just like, I can't believe I was suffering the way I was for months.
Exactly.
Taking, meds and I'm no longer feeling.
And now you're cured by a laser, no shots, nothing.
Exactly.
Yeah, I mean, physical therapy is completely safe, no side effects. All it can really do is just speed up the healing process. I mean, there's nothing negative about it.
Let me ask you, I know we spoke earlier that you were certified for, was it ergonomics?
Okay, so I'm also certified I'm a certified ergonomic assessment specialist. So with this training, I go into a business and I examine, the surroundings, and I identify risk factors for falls, for neck pain, for back pain, and then I'll write up a report explaining what I found and give my recommendations so that the employer can cut their workers' comp costs, because I'll be reducing the injuries in the workplace.
All right.
Get their workers' comp insurance down. So that's
do you give like a certification to the employees and stuff like that? Something to that extent?
We train the employees on.
We could provide them
not so much a certification, but it's more training in posture and body mechanics on how to sit, how to lift, carry, push, pull, and do it with good body mechanics.
Sometimes it's as simple as, I'm not kidding, the chair was just low under the desk, lower by 3 inches. And there's this magical place that the body should be in when we sit. Mm-hmm. And even like just simple adjustments that are not costly, where we're just raising the chair up a little bit, we're bringing the monitor here, we're putting it a little higher, we're making it so that the body has the least amount of energy necessary to do the work. Versus if you're all wrong, your body's struggling for hours and hours, weeks and weeks. There's fatigue unnecessarily, leading to neck, back, and it's crazy. So it's another one of those, oh my goodness, I can't believe, again, I was suffering all these weeks or months or years in my desk, and all they did was they told me to do this, to do that, and I did some exercises for, to undo some of the negative effects, and I can work better. So it's kind of cool. It's kind of cool that we do that.
It's basically designing like the job, the equipment, and the workplace to fit the worker, right? Think of a bike. You buy a bike that's not your size, right? I mean, it's just a matter of once you start putting miles in it, right? You may start to feel a twinge in your neck, in your low back. Maybe you bought the wrong size bike, right? So at the workplace, some people don't think too much. Is my work setting appropriate for me? Because the person that was working there before could have been a 6-foot man that brought in the computer, put it this way, put in a chair. Now comes this 5-foot person and thinks that everything is just supposed to be set up for that person. And so, it's important to think about these things. Is my workstation, is the computer high? Is the chair, does it have lumbar support?
Especially your neck.
The neck, the low back, does it have armrest?
Do you also treat carpal tunnel?
We do.
Absolutely.
We do. Yeah. So as you know, carpal tunnel is common,
Yeah.
And some people will sit at their work desk and rest their wrists on a hard table, right? Which is one of the risk factors actually for carpal tunnel, because if you put contact on the wrist from
it's a mechanical stress.
It's one of the stressors, or just having your keyboard in the wrong position. The mouse is too big, the mouse is too small. Same thing, the keyboard is outdated or it's not ergonomically correct. So all these things can apply little stressors. And look, when you think of stress to the body, it's cumulative, right? It's like taking a paper clip and bending it and bending it and bending it and bending it, and one day it's just gonna break. Well, this is how we develop pains in the body, right? We stress it, we stress it, we stress it, and then one day we want to blame that last bend. We went to go tie our shoes, or we went to make that lift, and that's fine. You can blame it on that. But what about, it's unfair to not take into consideration all the other stressors, right? So part of injury prevention is being a little more awareness.
It's like the little things that we do.
To improve a good, improve a good habit, right? The first step is awareness. So you got to be aware. And, we make patients aware of what they're doing correctly, what they're doing incorrectly, so that they can, do less of their poor postural habits and start working on improving the good habits. And, one of the questions I get a lot is, how long is it going to take to get better, right? And sometimes, the question that they should be asking is how many times do I need to practice to get better, right? Not how much time, because sometimes time goes by, and if you don't do anything as time goes by, you're going to be in the same place next year than you were this year. So for there to be a change, I think the question is more,
how many times do I have to repeat?
How many times do I have to repeat this behavior, right?
I guess maintenance is the key to wellness.
Exactly.
And and going back to the spine, right? Maintaining a healthy spine, right? It's a lifelong commitment to these things, good posture, good body mechanics. Basically,
But it becomes easier, even though that word lifelong sounds like, but it becomes actually natural. So the beginning is the hardest, when you're switching your brain into doing things differently, but then your brain gets used to
it gets more automatic.
The new stuff.
It gets more automatic.
Right?
Just like things that we do day to day that we don't even think about, brushing our teeth, tying our shoes. We do these things subconsciously, right? So the more you practice, then it does just become habits where you do it and you don't have to consciously think about it so much. And that is one of the goals with practicing these things.
And by the way, we make therapy fun.
Therapy is very fun.
We keep it fun. We keep the place upbeat. We keep, engaged with the patient. Like if you want to be better at, doing just something specific, like I haven't gardened in a long time, or I haven't been able to do this in a long time, I'll be like, well, let's do what it takes for you to finally do that. I can't pick up my grandkids the way I used to. I'm all about, what is it that, besides pain, do you want to see yourself doing again, and that the pain hasn't let you in a long time? And that's what's going to bring that person joy. So then that joy turns into the motivation to keep going and slightly alter all those things that we were maybe doing wrong, or all the stuff we learned in therapy becomes like worth doing, because now I'm doing those things that I love. So really, that's what we want people to know.
So obviously, seeing the progress, right, is a great motivator to continue doing our recommendations. Once they start seeing that they're better, that's motivation. That's the motivation right there to maintain the compliance and to continue doing these things.
I got probably the most important question out of the whole interview that probably everybody is waiting to know. All right. Let's say, what insurance do you guys accept? Do you guys have a cash only program? Because there's some people that don't have insurance and they're dealing with pain.
Exactly.
Tell us what you guys accept, what you don't accept.
So there's a general list of insurances. There's a major insurance plans that I would say to you.
Most of the major big companies.
We are in most of the major insurance plans, like the big ones, the Aetna, the AvMed, the Cigna, the United. We have Medicare, and we have some HMO. We have workers' comp, because you heard Nick talking about that earlier. We're part of some major workers' comp insurances. So if you're, if you're like a teacher or something like that, we're in those networks. And as far as self-pay, we created self-pay and wellness programs. So I have people all the time that have been my patients through their insurance, but maybe they have a limited amount of coverage and they want to stay on board with us. They don't want to necessarily go to a trainer because they feel like that may be too much, or they're overwhelmed in a gym environment. So they come to us. We become kind of their trainers. We call that wellness program.
Okay.
We also have massage that we do, massage packages, manual therapy packages, stretching. Laser packages.
Okay.
And so those are all of our cash, we put them on some kind of a payment program. And people really like how we keep our prices very reasonable, so that you can repeat the visits more than, it's not just once a week. We cater so that people can do 2 times a week consistently, and they get the results that they're looking for. And there's a lot of cariño, there's a lot of love, there's a lot of, of a feeling that I want to go there. If I'm going to be paying out of pocket anybody, I want to go somewhere where I feel so awesome. And one of the things I love is our patient satisfaction. We have like a lot of happy patients. If you look us up, you'll see all of these wonderful reviews on Google. And we get a lot of like wonderful reviews in there of so many conditions. We've talked a lot about spine, but shoulder, post-op, knee, ACL, rotator cuff. I mean, we're not just neuro, we're also ortho.
We've been around over 20 years. We've seen it all. So, we anything you can think of, any condition, any medical history, any comorbidities, underlying factors. I mean, we've pretty much at this point have seen it all.
Okay. Yeah, we've seen a lot of stuff.
Tell me the address to your location again.
All right, so our Kendall location is on 11440 North Kendall Drive. So we're right there close to the Turnpike and Kendall Drive.
Town and Country area. That Town and Country area off of 117th.
And it's right on the first floor. Patients love it because they just drive up and they can just walk right in. Very convenient location. Very, plenty of parking. And then our other location is in the South Miami, which is a very central location, close to George's office, and right by US 1 and Sunset Drive.
It's pretty close to South Miami Hospital, just to put you in perspective. It's just a few blocks east of South Miami Hospital, right where US 1 and Sunset meet. And we're in that corner building.
Production, if you can show the pictures so people could see that. So one last thing I want to ask you, obviously, what is your website?
Okay, it's MNRS.com.
All right. And are you guys on social media?
Yes, we are. Yes, we
Excellent.
are. We have been working on just making sure all the younger generations are also connecting to us because, our older generations, they use Facebook and things like that, and they go to Google, but our Instagram is growing. Our Instagram, community is growing as well.
All
so
right.
we're ready.
Anybody can feel free to reach out to me, or Carolyn with any questions, any concerns. They can get us on the phone. We'll talk to them for free over the phone and consult with them if they have any questions.
Okay.
So please feel free to reach out to us over the phone or through email.
All right. Excellent. Well, I really appreciate you guys coming on board and doing the interview.
Thank you, George. We appreciate
Thank you very much for having us, George. I mean, you have a great show here, great getting, information out and introducing the community to what's here and what, different services are available to them.
Exactly.
We love you, George.
Well, thank you. Well, I really appreciate it. It's not about me. It's about helping people, the people that are actually watching us right now. Because if I could help just one person feel better, I've done my job.
There you go.
All right.
That's what it's all about.
Exactly. Well, everybody, I hope you enjoyed today's show. Please reach out to them if you have any pains or, somebody that maybe needs help. That's the most important to feel better. And if you enjoyed the show, please give us a like. And if you really like it, please share it with all your friends.